Our countries, and when I say our, the Caribbean countries, have been polio free since 1982, measles free since 1991, diphtheria free since 1996, and rubella free since 2002. And our aim is to maintain this eradication and elimination of these diseases. That is what the whole focus is in terms of making sure that persons, new children that are being born, are immunized to maintain this elimination and eradication of these diseases. Because when the coverages go low, it means that the risk of these diseases being introduced into the society becomes higher. And that is why the Pan American Health Organization, WHO, CDC are all very gung-ho about encouraging countries to maintain their vaccination coverages, because we do not want the vulnerability that low coverages will give us. But it's not only about coverages, it's also about surveillance. And that is one of the things that we normally do. And when I say we, I talk about the countries in the Caribbean, countries around the world. We usually do surveillance for things like fever and rash, because fever and rash may be an indication that you may have measles. We also do surveillance for what we call acute flaccid paralysis, or weakness of the limbs, right? Which may be an indication that the person may have polio. And that surveillance is important, and making sure that you have robust surveillance systems in the countries is extremely important. And I want to take the opportunity to say that in terms of the Caribbean, we have a Caribbean EPI managers program and meeting. And usually every year we have a meeting and they give awards to the countries that do well. And Barbados would have gotten the award for surveillance, of the first place award for surveillance for the 2022, and we were second place in 2020 and 2021. And this first place that we got in 2022, which was for the year 2021, was the first time we came first since 2013. So we got that award last year when we went to the meeting.